Thank you very much. I'm honored to be here in this important conference. This conference is important because it helps us to share the experience from different countries with professionals, with policymakers. I came from Ethiopia, which I support the wastewater surveillance, which is a regional project which APHL is supporting with host institutions, with ministry affairs, public health laboratories. Wastewater surveillance is important because it can detect pathogens before they actually spread into the community, and it's part of the intervention protocol. I managed to present about our experience. The wastewater surveillance is important because most of the pathogens can be easily detected and the results can be communicated to the decision making for intervention. And most importantly, we're advocating for the wastewater surveillance to be integrated into the ongoing disease surveillance. We need also to collaborate regionally. We need to, resource is important. And most importantly, we need also to work with the stakeholders to communicate with the finding for a policy decision making. These are really the areas we are working on. In addition, we are expanding the wastewater surveillance to include priority pathogens and then identify what are the concern that we do have. And we can also link it to the policymakers. And in the long term, the wastewater surveillance has to be integrated with the disease surveillance system. The new technology, we can use the new technology, including the AI, the advanced bioinformatics system, data management. All this should be really helpful to monitor and detect diseases and for a decision-making process. Collaboration between countries and between the regions, particularly with Sub-Saharan Africa and the Middle East, is very critical. When it comes to Ethiopia and United Arab Emirates, they are really closely working. There is really population integration in there. We assume that we need really to build the scientific, the public health interaction, share experiences, and map resources. For Ethiopia, which is a developing country, requires also more resources from developed countries. I think we can really correlate and work together for the benefit of humankind.
For having me here at the Water Quality Forum 2025. I'll be speaking today about proper water labeling in the age of water innovation and sustainability. It's very important, and UAE is very good at providing credible labeling for bottled waters, which is important for the people and the consumers to trust what they are drinking, quality water. And UAE is doing a tremendous job at that. And I'd also like to talk about water innovation and sustainability. And what I do is I have a flashlight made with batteries, which are a new nanomaterial, three-dimensional graphene inside of this. That will also be used to filter water. That's water innovation in the future. And that will help protect the quality and sustainability and security of water. Yes, when it comes to the understanding of the water that people drink, I'm going to talk about the different types of water that we drink. You have tap water, you have bottled drinking water, you have natural mineral water, you have natural spring water in other places in the world. And so for the people to understand the differences, because they want to understand what they're drinking, so they trust the labeling and trust the quality of the water that they consume every day. Is very important, and the UAE is doing a great job at that. When it comes to innovation in water, I already talked about future potential water filtration technology. There's also a lot. You want to get all the wild ideas there are, because it's very, very hard to have sustainable sweet water in the desert. And Abu Dhabi, in particular, is asking for all the great ideas out there from all over the world. And one of the ideas, besides this, would be, for example, a Dutch scientist. He has the idea of using his plasma drill to go deep in the earth and then pour the seawater down and bring up supercritical steam. It's a new idea, but he has patented technology and he wants to raise capital or actually just to try out his innovation. There are many other innovations, and the idea is bring all the ideas here, because we really do have to tackle the future of water security.
I'm working with the local municipality and the industry in Japan for wastewater surveillance, and I'm also working for the wastewater surveillance project in the Asia countries, including the SARS-CoV-2, the AMR, and I'm going to talk about that tomorrow, our experience in Japan. My topic is wastewater surveillance practices in Japan and the future perspectives, and I'm going to talk about our experience that we have the wastewater surveillance project with the collaboration with the local municipality, industry, and the research institutes, and we develop technologies that collaboration with the private industry and implemented with the local municipality. And what is I think special in our project is we analyze the SARS-CoV-2 and influenza virus into wastewater, and not only that we publish in the dashboard, that we use a push notification on the social network services. So the alert will reach on your smartphones. So every Friday, so the people in a city they're notified, and they can visit the website, and they used to for their decision making, where to go, or whether they should wear masks, or where they should avoid a mass gathering, and so on and so on.
My name is Harun Shah. I work and live in London, England, and I have been invited here to speak on new technologies that may be implemented in water quality. And this is to do with the rapid detection of bacterial pathogens in water, in food, and particularly the aspects of microbial resistance, which is a big problem for us these days. The session this morning was all to do with water quality. Water is important. Water gets into the food chain. It carries with it the microbial pathogens. It carries it with all possibilities of disease. Being able to stop this process very quickly is central to what we do in all clinical sciences. And it used to take us many days, 4 or 5 days, to be able to do this. With some of these new technologies, we've got it down to 2 minutes. And one of these is called MALDI-TOF, mass spectrometry, which takes about 2 minutes to do. Because what is very interesting about this, it works on very small samples. It works very simple to implement. Somebody can learn to do this in a few hours. And most important, the cost of it is very, very low. So it would take about 4 or 5 days in traditional methods. This takes about 2 minutes. We don't require many cells. We need a tiny spot of sample to work with. And whereas this used to cost in British pounds about £500, it costs less than £1 to do it. So it's been implemented around the world in poorer countries, developing countries, so on. At present, one of the technologies I reported this meeting is a new field called Raman spectroscopy, in which we now hoping to bring this time down to 10 seconds. If that can be done successfully, we still at the early stages of research, and this is what some of the work I'll present today. We'll talk a bit about it tomorrow, but some of the work I'll present today, this would be a major step forward in solving disease problems, particularly in water and channels through which microbial pathogens enter the body. We use AI in everything now. We were using it for 30 years. We just didn't call it that. We call it machine learning, but it's been around a long time. So yes, it's customary to deal with AI with everything. It doesn't change the research. All it does, it's allow you to process more samples more quickly without the human being having to deal with it by eye. But at the core of it is not the AI. The core of it is the technology to be able to do this is what will change life for us completely.
طبعا حابة أشكر مجلس أبو ظبي للجودة والمطابقة وشركة M42 على تنظيم هذا المؤتمر بخصوص جودة المياه. كان لنا شرف المشاركة في هذا المؤتمر كالمعهد العالمي لمكافحة الأمراض والحديث عن بعض المبادرات التي يتبناها المعهد العالمي في كافة دول العالم على وجه الأخص المتعلقة بجودة المياه ومكافحة الأمراض المعدية. أكيد فخورين بهذه الجهود المستمرة في دولة الإمارات وفي أبو ظبي على وجه التحديد، وأيضا نضم صوتنا في موضوع مشاركة أفضل الممارسات الموجودة محليا على المستوى العالمي ودعم الشراكات العالمية لتطوير المنظومة العالمية للوقاية من الأمراض. تحدثت عن مبادرات المعهد العالمي لمكافحة الأمراض في مجال مخاطر المياه وكيفية الوقاية ودعم المنظومة الصحية في كثير من دول العالم، بما في ذلك مثال على ذلك دعم الجهود المبنية في تقصي لشلل الأطفال من خلال شبكات مياه الصرف الصحي. أكيد أن موضوع التقصي اليوم تقصي الأمراض المعدية وتبني الفحص الجيني هو مجال كبير للتطوير واستخدام البيانات لتنظيم الذكاء بيانات لإيجاد حلول في مجال الذكاء الصناعي لاستشراف المستقبل واستشراف والعمل بشكل استباقي للتعامل مع الأمراض المعدية والأوبئة قبل ظهورها. فأكيد أن هذه المنظومة للتقصي مهمة جدا، وأكيد أن القوة تكمن في ربط البيانات الصحية مع البيانات الغير صحية، واليوم تكلموا عنها الجهات اللي موجودة في إمارة أبو ظبي. فاليوم النموذج اللي موجود في إمارة أبو ظبي أكيد أن نموذج يحتذى به على مستوى العالم. كنا في نيويورك على هامش اجتماعات الأمم المتحدة، كان عندنا جلسة مشتركة مع الشركاء العالميين حول آخر تقنيات الذكاء الصناعي وكيف يمكن استخدام الذكاء الصناعي للوقاية لإيجاد الحلول للوقاية والتخلص من الأمراض المعدية.
It's a pleasure to be here. My name is Jesus Gomez-Mares. I'm the managing director of Waters Corporation in the Middle East, and I'm very happy to be here on this special event, especially when we're talking about water, knowing about that the whole planet is 70% surface water, and even the human body is made out of 60% water. I think it's very, very important to secure the health and safety of water in the Emirate, and I'm very proud actually to contribute to this mission, and especially with the collaboration that we just signed with ADQCC to develop new research capabilities specifically in the treatment and safety of water. The important topics of the event is particularly when you're actually talking about public health, and public health is something, especially when we're talking about a region that doesn't get natural water, and water needs to be treated in order to be consumed for agriculture, but also for cooking and everything. It is very important to actually secure that the test equipments are in place to secure that process. The main project that we are actually enforcing, or we are actually working at the moment, is PFAS. Many people are talking about PFAS as the forever chemical. It's a chemical that is used for many things in the industry, and the problem with that chemical is that it doesn't go away, and the more of this chemical that is used in our environment, we absorb it as humans, and in a certain level that can create health issues like cancer, but also other issues that are not really good. So that's why it's very important that we look into that, and this is a project that we are actually working right now with the authorities in Abu Dhabi.